In control, bugs crawling out of my skin. My body's in pain. I'm addicted to the crystal meth. It's driving me insane.
Aloha. Welcome to my lecture. This is Polymomy Medical Center. My name is Mark Baker. We are going to talk about methamphetamine. This is a 10-minute lecture. It's going to be fast. Hang on to your chairs. Get out of line, you get knocked by that pen.
I bet I have treated more patients with methamphetamine than any ER doc in the country. So my disclosure, I'm a visual learner. Hang on to your chairs. I have a website, but I don't make any money. I've got 3 goals for this lecture. I want to convince you of the problem. I want to describe ED presentations and treatment. And I want to give you and your patients some resources. So, we're going to start off with a quiz. Methamphetamine versus amphetamine. A, both can be prescribed. B, meth has a longer half-life. C, meth has 1 more carbon. Or D, meth is cheaper. Well, hopefully you got this answer. All of the above. Why does this matter? It matters because of the people we take care of. The most memorable patient still for me is a guy named Charles. Charles had a meth problem, took care of him a long time ago. He was on a transplant list, he started using again and he died. And many more have followed. What's it called? Used to be called ice more often, now it's more commonly just called meth. What forms does it come in? Check this out. These are crystals. Crystals can be heated and smoked. That's probably the most common use. Powder, water soluble. We are seeing more people injecting it. Rocks can be ingested. That's a really bad way to go. How hard is it to get? One of my patients said meth is like candy, and I won't mention the name. How much does it cost? It's getting cheaper all the time. This curve shows increasing purity with decreasing cost. This is a really good article. It was in the Atlantic. Sam Quinones. The name of the article is, I don't know that I would even call it meth anymore. Where is it coming from? Check out this heist on the border in San Diego. That is 5,000 pounds. I want to introduce you to Rico Witt. Rico is a drug intelligence officer with the federal high-intensity drug trafficking areas.
Most of the methamphetamine is being produced by the Cartel Jalisco Nueva Generación. Maybe $100 they sell it down there per pound. Right now on the border of the U.S. and California, it's going for as low as $400 a pound, something that used to go for $42,000 a pound. And if we're lucky, we're optimistic to say 20% of what comes through may be intercepted per year.
So it's time for a quiz. We're going to do some milestones. So LA Times article, the use of highly addictive ice is growing in Hawaii. The smokable form of meth ravages the minds and bodies of users. It's spread rapidly because it offers an intense, prolonged high without the use of needles. So when was this written? The year is 1989. Another milestone. Keep in mind that last article was written in the LA Times. There was absolutely no mention of a meth problem in Los Angeles. 30 years later, Steve Lopez, methamphetamine in Los Angeles, explaining that they've gone from cocaine to meth, and meth is much worse. Another milestone, 2019, meth overtakes opiates as the leading cause of overdose deaths in the western half of the country. So how many people die from methamphetamine? There is some data. See those towers in the middle of this slide? Those are our deaths from methamphetamine. Look on the far left. Those are deaths from fentanyl. How about national data? So psychostimulants, there's a lot of data, and they group psychostimulants together, but methamphetamine is now the primary psychostimulant. All those blue bars going up, those are increasing deaths from psychostimulants up to 2021. How about your own state? This is the percent of the population that they admitted to using meth during 2018 and 2019. Arizona's on the top, more than 2% of those surveyed. How addictive is it? Well, some people say it's the most addictive substance on the planet. That's because people get hooked with just one use. I want to introduce Dr. Rashi Shukla, who's a professor of criminal justice in the School of Criminal Justice at the University of Central Oklahoma. Rashi authored a book, and she hosts a podcast.
Becomes almost like a Rubicon where once you try it, your life can almost divide into before and after you had methamphetamine, and that becomes their sole focus for the drug and takes over everything in their life. And for some people that happens immediately. For all of my people, their lives went into a deep immersion that went along with their desire to get methamphetamine.
Australia's done some cool work relating to categorizing users. They have defined users as social, functional, dependent. I added one category to that, and that is dead. Social users, Those are people who would use it if it was offered to them at a party, but they would never buy it. Functional users, these could include drivers, shift workers, even newscasters. So there's really no immunity to drug addiction. Dependent users. This is a guy who I talked to in Chinatown, Honolulu. I mentioned San Diego and I mentioned newscaster. This is a newscaster who died from an acute overdose of methamphetamine. So recognizing users in the emergency department, that's one of our jobs. Think, if you have a young person with heart failure, think meth. Anybody who says there's bugs crawling out of my skin, think meth. Anybody actively tweaking, they're kind of moving around, they're hyper, they're tachycardic, hypertensive, and anybody who's paranoid. Stigma, something to know about. ASAP knows about stigma. They put on a conference. We need to know about stigma because we think this is just another meth user. But I want you to think every single one of those people was a happy 3-year-old at one point running around playing. This was from a YouTube of a guy who wanted to document his problem before he died because he knew he was going to die. So we'll talk about the medical consequences. Agitation, aggression, cardiac causes, that's probably the biggest. Skin, psychiatric, dental, stroke, thoracic dissections, they all can happen. So cardiac, congestive heart failure, that's a really big heart. I see 38-year-olds with heart failure and it's from meth. There's a lot of articles related to heart failure. Treatment for heart failure is the same as treating hypertensive heart failure. Compliance is the problem. So we take care of them in the ED. How long does it take to develop heart failure from meth? There is some data. One study showed it was taking about 5 years before heart failure develops. I think it takes longer before they're coming into the emergency department for heart failure. How long does it take to die from heart failure from meth? Hawaii's got some data. Great data. Look for the State of Hawaii Behavioral Health Dashboard. You can see these age groups. Notice the increasing frequency of death related to methamphetamine, and it increases all the way up to the age 65 and then it tails off. And unfortunately, the reason for that is not because people stop using it, it's because they're dying. Medical consequences, sudden death. Anybody who puts meth into an orifice like a body packer would is at risk. I took care of one patient who put meth into an orifice and almost died. Medical consequences, intracranial hemorrhage, psychiatric, confusion, delusions, paranoia, visual and auditory hallucinations. And one that still never ceases to amaze me is this concept that there are bugs crawling out of my skin, meth mites. More recently, I asked patients if they've heard about meth mites. They look at me like, oh yeah, I have. Do you think that's what I have? And I talk to them about it, and I say, it's like this perception. Other people get it, we don't know why, but it's the meth. Surgical complications. If you have somebody who's meth addicted and they need to go to the OR, let your anesthesiologist and your surgeon know. Skin consequences, there's lots of pictures on the internet. Teeth, the worst nightmare for a dentist, meth mouth. Social consequences, homelessness. This is our present governor, great guy. If you are not addicted to meth, when you become homeless, your chances are really high. So is there medically assisted treatment? There was a big exciting article published in the New England Journal that described treatment with bupropion and naltrexone, and it was working better than anything else, and probably did because nothing else is really working. So if you look at this study, they had a 13.6% response rate, and that compared to placebo, 2.5%. I want to illustrate that 2.5% because that's how hard it is to stop using meth without any treatment. The treatment group at 13.6, that's better, but that wasn't long-term and it didn't include side effects and serious side effects at a rate of 3.6%. And here's the problem. It takes like about 9 months to get over the use of methamphetamine, even 12 months. A lot of the patients in this study rescinded. They started using again. So, new treatment, contingency management. California is leading the way in that they have actually secured funding for treatment with contingency management. And I know this as a treatment is going to rub some people wrong because it's like, why should we pay somebody to stop using drugs? And the answer is, it works and it's a whole lot cheaper than paying for their medical care. It's basically incentivizing somebody to stop using the drug by rewarding them. What can we do about it with our patients? We can warn our patients, we can identify our patients, and we can do something for them. We can give them resources. NIH has great resources. SAMHSA is incredible. And your local resources related to teens. And in Hawaii, we've got a great local resource. I felt like I needed to do something, so I started an organization which lists a lot of those resources. Cool AI music. Aloha. There you go.